All right, Kylie, thank you. Well, IUPU Columbus is a pioneer in the nation with the use of virtual reality technology in the Indiana University School of Nursing Simulation Lab. One scenario that was developed for the lab is both timely and common to the region, neonatal abstinence syndrome, which involves an infant born to a mother addicted to drugs. In our Eye on Education segment this week, University Information Technology Services Director Bill Fields and IUPUC Director of Regional Healthcare Pipeline, Carrie. They're here now to talk about the technology and what it means for students and the community as well. Welcome to the program.
Thank you.
Bill, I'll start with you. This whole idea of using virtual reality in this nursing setting, IUPU Columbus, really a trendsetter in that regard. How did it come about? How did this begin?
So IUPU Columbus was using mannequins to do simulation. And those are very pricey and very hard to maintain once their life cycle ends. So it becomes really cost ineffective to maintain those.
Mm-hmm.
So we were looking for a way to not only keep the cost down, but yet really provide a simulation environment for the students that allows them to learn in a safe environment. And we looked all around. We eventually found SimX AR, which is a simulation software company, and they do virtual reality. And it was the ability to use cutting edge technology in that simulation environment.
Yeah, Carrie, talk about how you've integrated virtual reality into the curriculum. Some of the things that are used and how students, nursing students, really engage with VR.
Well, thank you very much, Gary. We integrated into the curriculum by including simulation in all clinical courses. Generally, the virtual reality is used for progressive simulation. Students start in the skills center, learning those foundational tasks, practice with the VR, and then go into another simulation where they engage with an actor, a standardized patient, and continue to apply those skills in a safe learning environment outside of the clinical setting.
Yeah, lots of opportunities, I assume, to use VR in the classroom. One of them, I kind of touched on this in the introduction, and that's with the opioid crisis that obviously is affecting much of the state of Indiana, many other states as well. How is virtual reality used in that regard?
So for our junior nursing students, for example, they have the opportunity to interact with a opioid addicted mother who has a newborn, and it's about providing care in a respectful way and also being in a very stressful environment. The babies have a very high-pitched, loud shrill that can be heartbreaking and difficult to listen to. So having that experience first and learning how to communicate with respect and to develop and understand the patient and develop that empathy is really important.
Yeah. Bill, as you look at this and, as a university, IU globally, I'm sure wants to stay on that cutting edge. This, I won't call it an experiment, but using virtual reality in this regard, does this lead to the, kind of those next steps? And how do you continue to invest to kind of stay ahead of the curve?
So we're continuing to look for new ways to use this technology. So one way is the augmented reality that has been talked about. It's not quite, the technology is not quite there yet. However, we are looking for, the SimX and us are partnering to look for ways to further simulations to bring in those standardized patients into that environment so we can do the physiology on them and allow for a better interaction between the students and not just a virtual reality person, but a real live person. Yeah,
Carrie, only have about 20 seconds, but how are the nursing students reacting and engaging with the virtual reality?
They love the experience. It's a safe learning environment. Again, they get to practice how they would behave, how they would act in high-risk situations in a safe environment. So it really supplements the curriculum.
All right, the nursing program at IUPU Columbus, really cutting edge in the nation in terms of using virtual reality and now augmented reality on the way too. Bill Fields, also Carrie. Thank you both for being here.
Thank you.
All right.